Is it becoming increasingly difficult for you to get out of the bed because of the pain that you suffer from early morning, and this pain gradually decreases over with time and as you go about the day? If it is so, then you might be suffering from something called rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory condition, and today we are going to discuss about it. Hi, I am Dr. Markandaiya. I am an orthopedic surgeon from Odisha, and I would like to tell you something about rheumatoid arthritis and how it might be affecting you, and what are the precautions and what are the treatments which are available right now for this condition. Rheumatoid arthritis is a chronic inflammatory condition in which it is an autoinflammatory condition. So your body starts attacking its normal cells and causes an inflammatory reaction at that site, which in turn leads to swelling, pain, deformity, and even loss of the bone or osteoporosis and that region. It is genetically inherited because of a gene called DR4, HLA-DR4, and it can also be seen in monozygotic twin in around 15 to 20%. It is seen in between the age group of 40 and 50 years of age, and it is more commonly seen among female as compared to male in around 3:1 ratio. This can also have a microbiological factor like a mycoplasma infection or a mycobacterium TB infection. It can also be due to an EBV infection or a CMV infection. These are viral infections which can cause this rheumatoid arthritis in a patient. Due to rheumatoid arthritis, they usually come with the complaint that, doctor, I am unable to get out of the bed, and once I get out of the bed, I have severe knee pain, I have severe joint pain, and as I start doing my daily chores, as I do my ablution and other activities of the day, then the pain gradually comes down and I am able to live with it. But initially it becomes very difficult to get out of the bed. Rheumatoid arthritis is a condition in which there would be bone loss at almost all the joints of the body. The joints which are spared is distal interphalangeal joint, this joint, distal interphalangeal joint, which is spared, and mostly all other joints are involved in this condition. It can be associated with rheumatoid nodules. These are small nodules which can be palpated around your elbow or around your ankle region, which you can palpate in these patients. Other features that we see is it can be associated with any pulmonary complication like interstitial pulmonary diseases would be associated with it. In skin, like I said, nodules you would be seeing. In eyes, you would see episcleritis or inflammation, redness of your eyes, those things you can see, or severe lacrimation, those things you would see. In nervous system, what would happen is it might lead to, because there is a swelling, it might compress any nerves, so neuropathies might occur in these patients. And lastly, that it can also affect your heart. It can cause pericarditis. Pericardium is the covering around the heart. It can lead to inflammation of that region, and it can cause problem for the patient. The investigations that we should do for this patient is a basic investigation that should be done is an X-ray to see the joint, how it is. Usually what happens is there is an equal sclerosis. Like if this is the joint, if this is the joint surface, then there would be equal sclerosis of the loss of the joint. It occurs most commonly in the cervical spine, but not in the lumbar spine. It is not common in this sacroiliac joint, which is the confluence between the pelvis and the lumbar spine. So in that region also it is very less common, but it is more common in this cervical spine. In cervical spine, we see this feature which is called a step ladder pattern. So what happens is, if this is a cervical, this is a vertebra, cervical vertebra, this is another cervical vertebra, what happens is between the pelvis and the lumbar spine. So in that region also it is very less common, but it is more common in this cervical spine. In cervical spine, we see this feature which is called a step ladder pattern. So what happens is, if this is a cervical, this is a vertebra, cervical vertebra, this is another cervical vertebra, what happens is there is subluxation or there is mild movement of the vertebral body, as a result of which there is a step ladder pattern appearance in those spines. There would be some kind of bone loss or osteoporosis that would be seen in cervical spine. There would be the joints of the cervical spine. It might lead to inflammation, and there might be some kind of fibrosis in those joints that can occur in these patients. The most differentiating feature here is that there would be less sclerosis, and there can be cysts around this joint. Periarticular cysts would be there, or nodules would be there in these patients. The most common deformities that we would see is the deformities of the hand. Like there would be a swan neck deformity. This is a swan neck deformity. There can be a boutonniere's deformity. This is something called a boutonniere's deformity that we can see in these patients. There can be a Z deformity of the thumb. There can be ulnar deviation of the, like everything would be deviated of the deviation of the fingers of the wrist of the hand that we can see. And there would be something called flat foot in these patients because of the muscle, tibialis posterior muscle would be insufficient to provide that. And all these things would be there, and with knee pain would be there in these patients as well. If we try to diagnose these patients, the most common diagnosis method would include few points. This is a Euler criteria which was given, and it suggests that if there are joint involvement, if small joints are involved, then it is more pointing towards rheumatoid arthritis. And if small joints are involved or not. Second, there can be a serological investigation. Serological investigations can be a rheumatoid factor test, and the other one is anti-CCP antibody that we can test. It is anti-citrullinated cyclic peptide antibody test. So that titer would also determine. And the third one is this the duration of the features. If the duration is more than 6 weeks, then only we can consider it. And usually less than 6 weeks is between that gray area, that if it is a rheumatoid arthritis or not, we need further investigations for that. And the fourth most important thing that is there, which we usually test for a patient, which is very inexpensive, it is the ESR and CRP value. It's called an acute phase reactant. So whenever there is any kind of infection or inflammation in your body, these two tend to shoot up. So higher the value, worse is the prognosis. In rheumatoid arthritis, there are few features which suggest that if it is an aggressive condition or not. If this Euler criteria, there is a scoring system. So if the score is more than 20, then it is considered as aggressive disease. If it is associated with rheumatoid nodules, then it is aggressive. If the ESR value is very high, then it is called then it is aggressive. If the rheumatoid factor value is very high, the titer is very high, then also we can call it as aggressive disease. Bony deformity and even peripheral eosinophilia are also factors which suggest that these can be a very aggressive disease. So what can we do for these patients? First and foremost, as I always suggest, that you must educate your patient. You must tell your patients, we must inform our patients that this is the thing that is happening to you, and these are the things that would eventually happen with you. So pneumonia and all those things can happen to the patient. Hydroxychloroquine, similarly, if you're taking hydroxychloroquine, then you should also have a regular fundoscopic examination for your eyes, because it can cause optic damages. Retinopathies can be caused due to these. The newer drugs which are available right now are like infliximab, etanercept, adalimumab, golimumab, or certolizumab. These drugs are available, but these are quite expensive, and personally speaking, it is very difficult to convince a patient to spend that much of money for this kind of medication and the treatment regimen. The end line of this is rehabilitation protocol that we should be following. Along with it, they need to go for physical therapy, which would help them to mobilize the joint, to keep them active, help them to do activities of daily living, and eventually increase the quality of their life. So here it is more important to increase the quality of your life instead of increasing the quantity, because a patient who is bedridden, and if he lives for around 5 years or so, it becomes a burden for them. It takes a mental toll on the entire family. But the quality of life should be increased, which is one of the primary concern for a doctor. What we can do is, if these joints are erosed, for specifically if these large joints are erosed and there is rheumatoid arthritis, we can go for joint replacement surgery. So we can do joint replacement surgeries. Apart from that, we can do this if there is any kind of entrapment neuropathy in those patients, then we can do a nerve release for those patients. If there is any loss of the tendons and so if there is any rupture, then we can repair those. And one of the treatment which has gone out of fashion, but it is being used at various places, is local steroid injection that can be done. One more thing that I would like to add here is that most of these patients, those who have got rheumatoid arthritis of the knee, due to the increased pressure because of the built-up fluid in the knee joint, there is something called a Baker's cyst. What is Baker's cyst? It is an outpouching, posterior outpouching of the synovial membrane, or the synovial membrane, which would outpouch to the posterior side of the knee. And it can be palpated, it can be painful, and it can be troublesome. It can reduce the joint movement, so that we can excise in these patients, and it would also lead to reduction in pain. I hope that this video was quite informational for you. If you have anyone who suffers from rheumatoid arthritis, or if you have someone whom you should be informing about rheumatoid arthritis, then do share this video. For similar content, please like and subscribe to our channel so that you stay updated with such content further. With this, I sign off today. Wait for the next episode where we will be discussing another common condition that we see in orthopedics. Thank you. Goodbye. Jai Hind.